Hey guys, welcome back. So today I'm going to have another health video for you. So I want to talk about something that I'm passionate about, and I've actually worked in the industry for the last 13 years. So I'm a registered dental hygienist. I've done that job for 11 years now. I have 13 years experience in the dental field. So I never quite understood why people don't floss their teeth. Even before I did this job, I always flossed my teeth. So your toothbrush and floss go hand in hand. One or the other is not optional. You need to use both to do a proper job cleaning your mouth and your teeth. So without the floss, you're missing 1/3 of all your tooth surfaces if you're only brushing. So you wouldn't have a shower and just clean 2/3 of your body and leave the other half, right? Or you wouldn't shower with just water. You'd probably use soap and shampoo. Yeah, you're gonna get kind of clean with brushing, but you're gonna do a really good job if you're using the soap, right? So brushing and flossing, it has to be done, you guys. So why should it be done? Okay, let's first state the obvious. So flossing, it helps to remove the plaque between the teeth. So plaque can start building up essentially the second after you scrape it off. So it does take, though, about 2 days to harden. So when it hardens, we call that calculus. Some people will call it tartar, but the proper name is calculus. So think calculus calcified. You know how when a ship is sitting in water and it has like all those barnacles on the bottom of the ship from the minerals in the water? That's essentially what calculus is. So our saliva has minerals such as calcium and phosphate that really harden the plaque on. So that's why you're going to see more plaque right behind your lower anterior teeth. So right here, that is one area our saliva ducts empty into our mouth, and also the saliva is pooling around the inside of our lower teeth. So even if you are really good to brush and floss, it will probably build up there on most people, as well as we have saliva ducts on basically the upper molars, the cheek side. So sometimes people will get it there too, depending on the makeup of their saliva. So basically, you want to get in there with the floss to scrape that plaque away. The plaque is just filled with toxic material and basically bad bacteria. So if we leave that sitting on our teeth too long, what it does is decalcify the enamel. So the enamel is that really hard white part on your tooth. It's the hardest substance in your body, but the plaque, it is so strong, it can eat through the enamel. So the first step in the disease process is always inflammation. So in your mouth, it's gingivitis. So basically, if you haven't realized, any word that ends in itis, it just means inflammation of. So gingivitis means inflammation of the gingiva or gums. So this is the first step. So how do we recognize gingivitis in our mouth? So you might notice bleeding, redness, or swelling, sometimes heat. So the most important thing though, if you notice bleeding, you know you have gingivitis. So it could be localized to one tooth, or you could have it generalized around every tooth in your mouth. So the good thing about gingivitis is it's reversible. So with proper brushing, flossing, using proper oral care products, you can reverse the gingivitis. So if the gingivitis progresses though, it gets into what we don't want to happen, and that's called periodontitis. So periodontitis is when that bacteria starts basically dissolving the bone away in your mouth. So again, it could be localized around one tooth, or you could have it around all the teeth in your mouth. So if you see somebody that maybe has a loose tooth in their mouth, and let's say it wasn't from an injury, that's probably what has happened. The bone has dissolved all the way down and not much is supporting the tooth anymore, so their teeth are loose. So you might see that in elderly people, or you could even see it in young people.
So here is a picture, obviously, of nice healthy gums. Healthy gums should look nice and pink and stippled. Unhealthy gums, it might look very red, especially at the gum line. The gum tissue might look a little bit bulbous when you're brushing or flossing, or with my instruments, it sometimes bleeds very easily. Right here, you can see this tooth has some gum recession. So right here, it's probably a couple millimeters of gum recession. So this is actually the root of the tooth that has now become exposed. The root of the tooth is a yellowy brown color. It's very soft. Ideally, you want the roots of your teeth covered. Just like if you think of the roots of trees, The roots of the trees are supposed to be covered by the soil, and the roots of your teeth are supposed to be covered with the gum tissue. If too much root of your tooth gets exposed, your dentist might suggest something like a gum graft to replace the missing gum tissue. Because remember, gum tissue cannot regenerate on its own. Once it's gone forever, unless you do a surgery to bring it back. So why we want this covered is because the root of the tooth is very, very soft in comparison to the enamel. So what will happen over time, it's very easy to get cavities here. The bacteria can penetrate the root surface very easily. And as I mentioned before, kind of like the little windowsill ledge, plaque really likes to build up here. Sometimes just through, drinking something hot or cold, having something acidic or sugary, it might feel very sensitive because there's not that hard protective coating like the enamel. So all your little nerve endings are exposed here. And even through regular brushing, over time, it'll probably get a cupped out appearance. Kind of like someone took a couple chops out of a tree trunk. So ideally, you want this gum recession covered by the gum tissue, just to protect the tooth, okay?
So the main reason why I would want people to floss and brush properly, basically just take care of your mouth in general. So that also includes seeing your dentist and dental hygienist regularly, and going for cleanings or scalings at the recommended intervals that they suggest to you, is to decrease the overall inflammation in your mouth and your body. Because like I said before, what's going on in your mouth, it's mirroring what's going on in your body, and vice versa. So every disease, the first step is inflammation. So we want to decrease that. Why do we want to make our body work hard fighting off this inflammation when maybe we could just brush and floss properly? I'm not saying that that's necessarily the quick fix for everybody. That it most certainly is not. I just want you to remember that bacteria in your mouth can hijack your immune system and affect all the other systems in your body. So if you have an infection or basically a chronic low-grade inflammation going on in your mouth, basically your whole body is trying to work overtime, trying to fight that off. Okay, so what's going on in your mouth is often mirroring how healthy the inside of your body actually is. Flossing and brushing your teeth properly is a part of self-respect. So it is part of self-care. When you're not taking care of that, it can not only be detrimental to your own health, but it also can be detrimental to relationships. I can't tell you how many times I've avoided a person because I know that their breath is bad. Now, I'm not saying that all of the time that can be prevented from brushing and flossing. There can be a lot of other things going on with your body that can cause things like that to happen. A lot of the times, actually, I think it is diet related, or you might have GI issues. But brushing and flossing, I can't tell you how many times when a patient actually just changes this habit and brushes and flosses, it is like night and day transformation. Even the simple act of switching from a manual to an electric toothbrush can help a lot. Introducing things like tongue cleaners, Waterpiks, switching up the floss you're using, mouth rinses, it can have a great positive effect. The bacteria that lives under our gums does not require oxygen to survive, so it's anaerobic. So that type of bacteria unfortunately gives off a really nasty smell. It's almost like a sulfur type gas. So that can be very offensive to the people around you or even yourself if you have to smell that. So you want to really remove it daily to get that off. You also really need to brush your tongue, go far back. I know it's hard if you gag a little bit. A good thing to use would be a tongue scraper. It almost looks like a little bit of a rake and it scrapes all the bacteria off, especially after you have coffee or something like that. The top of your tongue really holds a lot of bacteria. So you need to floss to reduce that bad odor, prevent cavities between your teeth, and reduce the inflammation / gum disease process.
I'm just going to show you guys a chart. So this is how I would explain this to my clients. So when you go to your dental hygienist and they do the periodontal measurements, you might hear them calling out a bunch of numbers, and they're recording the depth of the gum pocket around your teeth. So this little instrument we use, we call that a periodontal probe. It's almost like a little ruler measuring in millimeters. So when this little instrument sinks in 1 to 3 millimeters deep around the tooth. That's a healthy gum pocket. We do 6 measurements around each tooth. So if you kind of think of how a turtleneck comes up along the edge of your neck, that's almost the same as what the gum tissue does. So this should only sink in 1 to 3 millimeters deep, and that's a healthy gum pocket. So in this picture, the gums and the bone are very healthy. Let's just say you're not flossing. So what will happen over time is plaque and calculus are going to start to build up on the edge of the tooth. That is filled with toxic material, so it's eventually going to eat away or dissolve the bone and the gum tissue. So you can see now in this picture how this little instrument is able to sink in deeper. So at home, you can clean a 1 to 3 millimeter gum pocket well with your brush and floss. If it gets deeper than that though, you're not able to reach the base of the sulcus. So there's always going to be, you know, a millimeter plus that you can't clean out. So with my instruments, I can access that, but that means you'll probably have to go to your dental hygienist a little more frequently. So sometimes we might recommend to people, if they have bone loss around their teeth, that they go see the dental hygienist for a scaling every 3 months, because the bacteria that causes destruction to the bone is at its peak height after 90 days. So that's our reasoning behind recommending a 3-month interval for dental scaling. So I just want you guys to remember, once the bone starts to dissolve away, that's permanent damage. You can't grow it back. So we need to stop it before it gets to this point. So when you're flossing, really make sure not to just put the floss in and out. Really hug it to each side of the tooth. Hug it in a C shape around each side, because if you're just snapping it in and out quickly, it's not really scraping and disturbing the plaque that's sticking to the edges of the teeth. Here you can see the same images, but they're showing it on a radiograph. So here is healthy bone. So all the light gray stuff in here is the bone. And then there is an example. It looks a little darker there. The bone has dissolved away. So this instrument is sinking in a lot deeper. And remember, the bacteria that lives in a pocket that is 4 millimeters plus, that is the stuff that emits like a sulfur-like gas. It smells really, really bad. So that might be what is causing your bad breath, or the odd time you might, when you're flossing, you might notice the floss doesn't smell very nice. That's probably what you're removing. Sometimes the floss can go down, you know, I would say 4 millimeters, but usually a 3 millimeter gum pocket is pretty much as deep as you can clean at home effectively.
So why you want to stop gingivitis from progressing into periodontal disease is because periodontal disease is not reversible. Once you have that disease in your mouth, you have it forever. Yes, you can manage it, control it from getting any worse, but it's never going to reverse itself. So once you lose the bone in your mouth, which is the main thing holding your teeth in place, you can't grow that back. So say if you did lose a tooth and we had to put an implant in there to replace the missing tooth. Yes, the dentist can do a bone graft, but this is not really the same sort of thing. You can't grow back either missing gum tissue or bone. So what you have in your mouth, you really, really want to preserve forever. When we look in your mouth at a dental office, sometimes we can tell you conditions that you're going to have going on in your body either now or soon. So sometimes when ladies get pregnant, you can have what's called pregnancy gingivitis, meaning that your body is just having an exaggerated response to the plaque in your mouth and the gums bleed really easily. There might only be a little bit of plaque around the gums, but they bleed very, very easily. Even with like the lightest touch, it's gushing blood. So sometimes we can actually tell that a woman is pregnant before she even knows that. A lot of times too, just by how a patient's breath smells, we could tell if they're diabetic. Also, when I look in your mouth, and if you're pretty young and you have severe periodontal disease, you have probably a 20 to 25% increased chance that you will get heart disease. So when you see bleeding in your gums, don't let that discourage you from flossing. That area of your mouth is the most inflamed. It actually needs the floss the most. So you just want to gently go in there and make a C shape around the tooth, scrape up and down each side of the contact to really loosen the plaque up. I would say you would probably have to be flossing every day for 1 to 2 weeks for the inflammation to go down quite a bit and reduce the bleeding. Now, if you haven't had a dental scaling in a while, you're going to want to go do that and basically get everything cleaned off above and below the gums, and then maybe start your new flossing routine.
And here was what I was talking about by curving the floss in a C method. If you're, yes, it even says on here, don't snap the floss between your teeth. That can sometimes cut and irritate the gums. Just seesaw it through gently. Use, if you're having a hard time with the unwaxed, definitely get a waxed or a tape version that might be able to slide through a little bit easier. Sometimes it doesn't grip as much plaque as a unwaxed one, but a lot of people have very tight contacts. There's no way they could get an unwaxed floss through.
Overall, it's really, really important to floss and brush properly and take care of your mouth to decrease the inflammation in your whole body. So inflammation is the first step in pretty much any type of disease. So by eating an anti-inflammatory diet, that also not necessarily just helps your body, helps you aesthetically, helps your stomach, it's going to help your teeth as well. Just like, you know, working out too hard every day is going to cause a lot of inflammation in your body, it's not going to be the best for your mouth either. So overall, for your whole body in general, you want to lower the inflammation. So when I made my eczema video, which probably a lot of you guys have watched, I talked about eating an anti-inflammatory diet. So that is different for everybody. I'm not saying everyone should eat a vegan diet. That's not what I'm saying. You know, even some fruits or vegetables could be inflammatory for you. Everybody is different. There's ways to figure that out, but that's a whole separate talk. So again, just to reiterate, the #1 sign that you have gingivitis is bleeding gums. I've heard before the saying, if you know, you brushed your hair and your head started bleeding, you'd be very concerned. I bet you probably go to the doctor, right, that day. A lot of times people tell me, oh, I don't floss, I'm not brushing, because whenever I do, my gums are bleeding. Well, the reason they're bleeding is because you're not doing it enough. Now, of course, there are certain things that can contribute to bleeding gums. You might be pregnant, have pregnancy gingivitis, you could be a mouth breather, all sorts of things. If you're a dental professional watching this, trust me, I'm not meaning to skip over this stuff, but I mean, there's so many specific things that could be going on in someone's mouth. I'm just kind of trying to give like an overall general video that most people could benefit from. So when your mouth gets stressed out or inflamed, bleeding, basically your whole body gets stressed out. The bacteria in your mouth can basically kind of take captive your immune system. So I can't tell you how many times I've had a client who maybe hasn't been to the dentist in decades or years, and their mouth is in pretty bad shape. Eventually, once we get them all cleaned up, they tell me, I don't get sick anymore, I can taste things better, you know, my allergies went away, etc., right? It's all connected. When your body is trying to fight off this type of infection, the energy is going here where it could have been going somewhere else to help repair your body, right? So inflammation in any part of your body, basically it helps to protect the cells. So the bad thing though is when inflammation stays present for a long time, it actually encourages the growth of plaque. So this can be in your mouth or in your arteries. So probably most people know we should be brushing for minimum 2 times a day, close to 2 minutes each time. I'll just let you know, everybody should be using extra soft or soft bristle toothbrushes. They shouldn't even be allowed to make medium or hard. I remember learning in school, the only thing those things are good for are scrubbing the grout in your shower, and I agree. So the softer the better. If you are used to using a hard bristle toothbrush and you switch to a softer one, you might feel like, oh, this isn't getting my teeth as clean, but trust me, it is. You just have to brush for the full 2 minutes. So a minute on your top teeth, a minute on the lower, and you're gonna get your teeth clean. It might not have that same like vigorous sensation on the gums, but a really hard bristle brush, it's too abrasive. It's gonna wear your gums and the enamel down over time. And also always be using a non-abrasive toothpaste. So whitening toothpaste, tartar control toothpaste, they are too abrasive to be using every day. Studies now show that those can wear our enamel thinner and wear down the gum.
Brushing, always use an extra soft bristle toothbrush just so it doesn't damage the gums. We all tend to brush a little bit too hard, but if you're using a really extra soft brush, it shouldn't do any damage to the gum tissue. And also use a non-abrasive toothpaste. So avoid whitening tartar control ones. The simpler, the better. So you can see here, you really want to angle the bristles up into the gum line on the upper teeth and down into the gum line. You're not going to want to scrub back and forth on them, but angle them into the gum line a little bit and go in small circular massaging motion. I always tell my little kids at work, kind of like right here where the gums and the tooth meet, it's almost like a little windowsill. And lots of, obviously at home, dust or whatever can build up on a windowsill, and it's almost the same in your mouth. It's like the plaque likes to build up right along that edge, so you have to do a really, really good job cleaning right at the gum line and obviously in between the teeth. It's okay if on the biting surfaces of the teeth, if you want to brush a little bit harder, it's okay to get into the deep grooves, but be very careful anywhere where there's the pink soft tissue, because that could be damaged if you're brushing too hard.
I'll link in the down bar some of the flosses and dental products that I recommend. So I really, really like electric toothbrushes. I like either Philips Sonicare or Oral-B electric ones. Again, I would get sensitive or extra soft bristles. For floss, personally, I'm not a huge fan of those little floss sticks. So I find them really good to floss the anterior, the front teeth, not so much for the back. I like the string floss. You can curve it more in a C shape around the tooth. So you really want to scrape it against each side of the tooth. I find those a little hard to get back there. If that works for you though, by all means do that. It's better than nothing at all, to each their own. You can also use a Waterpik, which is kind of like a little mini pressure washer to clean between the teeth, but ideally you still want to get in there with a floss to really scrape the edges of the teeth. So just to quickly go over again, flossing really helps to decrease the inflammation in your mouth. It helps to preserve the bone in your mouth that holds the teeth in place. It reduces the bad odor coming out of your mouth, reduces the chance of getting interproximal cavities or caries. So that means a cavity in between your teeth, and it also decreases the inflammation in your total body, which is amazing. I should just say, just so I don't ruffle any feathers out there, that I'm not saying that brushing and flossing is going to just save everything going on in your mouth. There are people that I see that never floss, sometimes never even brush, and they never get a cavity, they don't get that much inflammation going on. There are those rare cases. When we see you as a client, we're gonna make everything client specific to you. I'm just kind of trying to provide a video that I think basically would benefit the majority of people. So I'll just say a few tips if you have young children out there. I used to work at a pediatric dental office, and I still do see lots of little kids as my clients. So it's really important from a young age, as soon as the teeth start touching in your child's mouth, you need to introduce floss. So I always like to tell kids that the floss is a toothbrush's helper. He gets where the toothbrush can't reach, essentially. So as soon as the teeth touch, you need to be flossing, otherwise a cavity might form, especially on a baby tooth. The enamel is not as thick, so a cavity can start forming pretty quickly, and it can actually turn big and painful a lot quicker than on an adult tooth. So a lot of times some people might think, well, it's just a baby tooth, it's eventually going to fall out, we don't really have to take care of it. That is the wrong way to think. A lot of baby teeth you might need from up until age 10 to 12 years old, sometimes even a little bit longer than that. And the baby teeth hold the room for the adult teeth to come in. So basically from a very, very young age, you need to introduce this into your child's life. Also, it's important not to, if you've had negative dental experiences in the past, not to put that on your kids. I can't tell you how many times I hear a parent say, like, you know, it's only going to hurt for a second. I don't like being here either. You just have to suck it up and do it. Just don't put that into their head. Make it a positive experience. Encourage your child to go into the dental operatory by themselves. And I find a lot of times they do better on their own. A lot of times parents will be in the room saying stuff and they think that they're helping, but it's doing the opposite.